Making work safer for doctors, nurses, and technicians as they treat people with heart disease.
Colleen Sikora is looking at a better way to protect those vital frontline workers.
On the football field, it's helmets and protective equipment that changed the game.
We want to score touchdowns. We want to make sick people better.
In the Cath lab, Dr. David Reisig believes this is the equivalent.
Here's the main shield. Here is the side shield.
As it's radiation staff working here are exposed to.
This is not a benign thing.
Adding up over the multiple procedures in a day, over decades.
By the time you were at my stage in your career, having no protection to your face, you have been exposed to the equivalent, your face, of about 25,000 chest x-rays.
The only protection to parts of the body, a lead apron like this, and that can bring back or other orthopedic issues, like what Dr. John Neal, a vascular and interventional radiologist, had before joining Honor Health's executive team.
I woke up every day for the last 10 or 15 years with a sore back, and my wife would watch me, crawl out of bed with back pain. And since I've removed myself from that environment, now I work just in a physician executive role, my back doesn't hurt anymore.
But the radiation.
This is Dr. Dietrich, and he was one of the most remarkable innovators in the history of our field.
Reisig says can also lead to cataracts and cancer.
He died very likely from the consequences of radiation exposure. He developed a brain tumor.
That's where Reisig's new study with Honor Health Research Institute steps in.
How much radiation did I get?
You're still holding 0 and you're over 30 minutes fluoro.
30 minutes of fluoro time, and I haven't had an ounce of radiation.
Testing how well a shield like this blocks radiation.
68% of the cases, there was no radiation exposure at all. It was imperceptible to the physicians and nurses.
Believing less exposure.
This is really about the next generation of doctors and nurses coming up.
Could change the game in the Cath lab.
I believe this will extend careers. I believe we will be able to recruit doctors and nurses much better to a safer work environment.
Colleen Sikora, 12 News.